So before I hand the mic over to Dr. Hobeka, we have a few housekeeping things to go over. First of all, today's webinar will be available on YouTube. Second, we'd love to hear from you during today's presentation. If you have a question for our speaker, please wait until the end during that selected time, utilizing the chat button at the bottom. If we don't get to your question today, we will follow up afterward. Also, please keep your video off and your speaker muted. Last, we'd love for you to share this webinar on social media, so you can follow us at Fertility Centers of Illinois on Instagram and Facebook, and please hashtag using Virtual Fertility 101. So without any further ado, I'd like to kick things off by welcoming our physician, Dr. Ellie Hobeka. Over to you.
Thank you. Thank you so much, Marin, and welcome everyone, and thank you for giving us part of your time this afternoon. I'm Ali Hobeka, one of the physicians at Fertility Centers of Illinois, and I am thrilled and honored to host this webinar entitled Virtual Fertility One-on-One. I am pleased also to be doing one of the highlights of my career as a fertility specialist, and this is patient education. So as great thinkers previously said, knowledge is power. So the main goal of this webinar is to empower you in the beginning of your infertility journey so you feel confident and make the right decisions. However, because we cannot please you all and address everyone's needs, we will be opening the floor for questions after we're done with the different talks, and we will be answering those questions as long as they keep coming. I personally have no plans this evening. I hope our lovely panelists don't have any as well. Before we get started, I hope that you all can see my screen over here that I'm going to share. So before we get started, as a human race, we are limited by a certain framework that Mother Nature has for us. So to create one of those, we need three main elements. The first is sperm, the second is egg, and the third is a uterus. So with that being said, when should you come to us? When should you seek care by a fertility specialist? And another way of putting it is, if you are sitting in one of our waiting rooms, who may be sitting next to you? I mean, I believe in those days, who should be sitting 6 feet apart from you? So we started initially by heterosexual couples, and those are defined by a male and female partner who are trying to conceive. And those are preferably seen after a certain duration of having unprotected intercourse and inability to achieve pregnancy. This duration is mainly dictated by the age of the female. In women younger than the age of 35, we prefer to see the couple after 1 year or 12 months of trying. In those 35 years of age and older, we recommend seeing the couple after 6 months of trying. In couples where there's an evident cause of infertility, such as in women with irregular menses, or if men have had a vasectomy procedure, or if women have tubal ligation, there is no point of trying, and we recommend to see the couple as soon as they would like to start having their family. As for same-sex couples, single parents, and transgender couples, they usually lack one of the three components that I mentioned earlier, and we recommend that we see them also as soon as they desire to start their families. Throughout the course of this talk, we will explain the concept of the biological time clock in a female. So consequently, you may find as well sitting next to you in our waiting room, women who would like to preserve their fertility potential until later reproductive years, and those who have cancer and are about to undergo treatment that may destroy their fertility potential and would also like to preserve their eggs before undergoing such treatment. Last but not least, you will also see individuals who would like to donate their eggs to other single parents or couples. So how does it all start? Initially, you will call our new patient call center and schedule an appointment. You will receive a medical form to fill, and we will ask you to fax or email any records that you may have. It is preferable if those documents are completed prior to the encounter to get your physician prepared to have him or her understand your needs and address your concerns in a better way. So fill the medical history forms and send in your records. On the day of the visit, make sure that you have a smart device, a tablet or a laptop with speakers, microphone, and good internet. This allows a smooth flow of the consult. Do not worry if our consults are only done via telemedicine right now. Most of what we do in the office is talk anyway, so you're not missing on much. With telemedicine, partners can also participate even if they are not physically present with their significant others in the same room. And you will receive also a welcome letter among the initial paperwork. And because we live in an insurance-controlled medical field, I will introduce you to Judy Petruzik, our financial coordinator, who will give you some basic information that will help you in the beginning of your journey. Judy, I believe the mic is up to you.
So hi, I'm Judy. I'm the financial coordinator supervisor here at FCI. And what our department does is try and guide you along so you can have a smooth financial experience. We help you understand your insurance, what deductibles, out-of-pockets means, and the type of coverage that you would have with your particular policy.
Perfect. I'm going to start sharing your slides.
So here in Illinois is what we call, it's a state mandated for insurance. And that all depends. It has a lot of criteria that need to be met. Not because you have insurance in Illinois means that you will have mandated coverage. It depends on a lot of things. So what we will do is once you make your new patient appointment, our pre-cert department will verify your insurance. We will get all that information. We will send you a welcome letter with some of the most important points of your insurance. And once you get that, if you have any questions, all our contact information is on that letter, and we will walk you through the letter and through the estimate that we send along with everything, as well as your insurance from A to Z. You have any questions, we can tell you about the different types of infertility coverage that you might have. You might have just a monetary cap. You could have 4 IVF attempts per year. Other insurance companies will give you 4 per lifetime. Some will only cover your diagnostic testing. Others require that you get prior authorization for all services, and our office will take care of that for you. The downside on that is that sometimes it can take up to 15 business days and sometimes even longer, but we would take care of that for you. And basically that's about it. Once you start your workup and everything, you will be assigned a financial coordinator, and that person will help you with any insurance questions that you may have or any concerns, anything like that. You would be able to reach out and contact your financial coordinator. Thank you.
Okay, thank you, Judy. With that being said, we get to our the day of your consult. What exactly happens on that day? First and foremost, we'll listen to you. We hear your story. How did you how did you end up coming to us? What are your family building goals? Why did you come to us? And then we usually follow by a certain number of relatively boring questions that have to do with your medical history, surgical history, social habits, and we ask some questions also about your family. We then address your concerns, answer any questions you may have. But during that process, we ask you a lot of questions and we know a lot about you. So a good way of me starting the consult after we hear your story is by introducing ourselves. Let's have this relationship equal. We know a lot about you, but you do not know anything about us. Who are we? So we're called the Fertility Centers of Illinois. We are a fertility practice that got its name in 1993. However, our founders have been practicing reproductive medicine since 1976. One of our current partners is a doctor on record of the first child born by IVF in the whole Midwest, and this was in 1984. Before Corona, we used to operate out of 9 locations. Unfortunately, we are currently 3 down, but we look forward to be opening those offices back up soon. In this practice, in addition to me, there are 10 different partners. When your treatment starts, usually pick to have care with one physician. We occasionally cover for one another, but most of your treatment and testing will be with one physician or that you picked. And then we get into the important stuff. So back to the basics. To create one of those lovely little children, we initially start with an egg and a sperm. But the production of sperm and eggs varies differently in both males and females. Men are born with 0 sperm, and when they hit puberty, they start making millions of it. Women, on the other side, had already their millions of eggs before they were born. And by the time they're born, this number goes down to 1 million. By the time they get to puberty, this number even goes down to 500,000, and it keeps on decreasing as women grow in age until they get closer to the age of menopause. So the main ability of a couple to conceive is the age of the female partner, and that kind of represents the biological time clock. One may argue that in the early 30s, fertility is not too decreased from what it was in your 20s, but we definitely know that we start seeing more and more this decrease around the age of 35, and it sharpens around the ages of 37, 38, and 39. So where are your eggs located? This is a picture of an ovary, and the ovary at the beginning of every month have those dark circles, and each dark circle represents the packaging of every egg. In women who have a normal cycle, every month one of those follicles grow while the others remain small. And whenever the follicles get to a good size, the egg leaves the ovary and goes into the abdomen. This is where the egg is picked up by the fallopian tube, and sperm supposedly should travel the opposite way, all the way up the uterus through the fallopian tube to come to fertilize the egg, and then the embryo that forms continues its way in the fallopian tube to come and implant inside the uterus. So whenever we initially see either a single parent or a couple, we want to make sure that all these different steps are functioning normally and the way they should. So the workup will technically end up being an ultrasound and blood work for the female partner, and a semen analysis and blood work for the male partner. And most couples will leave my office getting a checklist where we will check boxes on the different testing that we'll do and what we usually would recommend. After the testing, after we suggest the testing to be done, we will give you some medical advice, technically comment on your social habits, on your lifestyle, give you some tips that will help you boost your fertility. Tammy will go into more details through the subject, so I'm not gonna dive into its very minute details, but we usually meet approximately 4 to 6 weeks after our initial consultation. And I want to say 6 weeks is like the upper range of the interval, and this is only the case whenever, as Julie mentioned before, some insurance requires 15 days to approve you for testing, so testing may be delayed by 2 to 3 weeks. And then we meet again. We go over results of the testing. We go over your diagnosis. Why do we think that it has been taking you longer to conceive? And we make a treatment plan. The main treatment plans that are in our world include an insemination, and this is when males produce a fresh specimen, or we use a frozen specimen that we thaw. We wash the sperm, select the best moving ones, and insert them directly inside the uterus. Hopefully they can travel, find the egg that's usually sitting inside the tube, like you can see on the picture here. Or we can do our big guns, which is in vitro fertilization. And this is technically the same technique as test tube baby technique. And this is when women take daily injections to grow as many eggs as we can on their ovaries in a safe way. And whenever the follicles get to a good size, we go in with a needle, aspirate the eggs outside of the body, mix them with sperm, create the embryos, and put the embryos back inside the abdomen and inside the uterus. And then we decide on one plan. And to end, this is a picture of the first child born by IVF in the world. Her name is Louise Brown. She's born in 1978, and she's very close to celebrate her 42nd birthday. And that's usually how our first encounter ends. by giving you an overview of testing and then a briefer overview of treatment, and then we usually hang up. And next, you get the chance to meet one of the nurses, and there's no one better than Allison Schism, one of our registered nurses here at Fertility Centers of Illinois, and our clinical research nurse to go over this experience with you. I'm gonna stop sharing right now, and I believe we're gonna go live to Allison.
Thank you, Dr. Hobika. You're too nice, but I do absolutely love working at Fertility Centers of Illinois. I've been there for just over 3 years now. I actually got into fertility because my husband and I went through having our own challenges with having kids in the at your home way. So we had to seek fertility treatment at that time. And my experience with my nurse, who was just so informative and just such a great communicator, is what really led me to want to do this. So I moved over to Fertility Centers of Illinois and now work with just a fantastic team, which I'm so excited that you guys get to hear from them today. So I want to go over the roles of what a fertility nurse does. We have a huge team that works together, so you will see different names along with the physician. And as Dr. Hobika mentioned, you might see other physician names, but for the most part, it sticks to your main physician. We work together to help you stay in contact during your cycle and to help coordinate all of these different areas that you are going to be hearing about. When Judy talks about having financial input, we definitely coordinate with our financial coordinators, asking for updates if we need them, if insurance is taking that 15 days, or getting approvals and letting you know that you're ready to start. So we coordinate with them, the Andrology lab, our embryologists, our surgery center, and phlebotomy and ultrasonography. So we are really the main point of contact as you go through your cycle, as you figure out that checklist that Dr. Hobika shared, which can be super overwhelming. We will walk you through every step of it and make sure you know what's still missing or what you still need to do. We don't expect you to go and then come back with a done checklist. We're gonna help you through that whole process. We coordinate with your local and specialty pharmacies to make sure that you get your medications when you need them. We will also review the testing that you need as far as what tests and the treatment process so that you understand where you're going and what your next steps are. And then we also will send you a lot of the results, and then also often we'll communicate on a daily basis what the physician is sharing with those results. So they interpret the results, and then in a consult, you will go over all of them. But if you just get like a level in a test on one day, we will actually help explain that as well. We're also your advocate. Your treatment goals are our goals. We want to help you succeed, and we want that plan that you made with your physician on how we're moving forward. We want that carried out as best as possible. We understand that this is a super overwhelming process. Most people, myself included, never thought I'd be here. Never thought I'd need fertility treatment. I was young and more concerned with not getting pregnant than with thinking we would ever need assistance. But that is also why we will advocate for you to seek other sources of emotional support and holistic support. We've got Tammy, and we partner with Pulling Down the Moon. They offer holistic treatment options. We definitely always encourage patients to seek all their resources that are available to make this process as smooth as possible and as less stressful as possible. Pulling Down the Moon has actually helped a lot of patients through their journey in the fertility process. And then in addition, with the emotional support, we have on-site psychologists, such as Susan, who is on our team, as well as Dr. Edwards. And they are available for meetings, and you can schedule those. They're doing those online as well, because we know that this is an emotional roller coaster to go through the fertility process. As nurses, we also go through educating. So we teach you about your cycle. We teach you about medications. We also provide you with online resources so you can see the process going through basically a review of what the physician has already talked about, but we provide it so you can see it again, because we know it's a lot of information to get all at once. Some of our physicians actually have Instagrams, and so you can get daily updates and tips. helpful hints from them as well. We have educational videos and articles, and then even our STI Facebook page has testimonials, and you can just see some really cool success stories as well. If you have information from Google or your friends that have told you a story, please bring that to us. We would love to talk to you about those and help you sort out the truth and the myth. You're gonna, we want you to get the accurate information, but we also know that everyone has different experiences. So we'd love to talk through and explain if either your situation is like that or not. And then finally, we love celebrating with you. It's the best part of the job. And we love sharing in your successes. We used to hug before COVID-19. Now we just laugh and elbow bump. I think we do that still too. But we also, we love the good news, but we also are there during the bad news. We know that it's not always going to be great news. There are a lot of ups and downs. And so we are there to cry with you and comfort you during the hard times. Whatever way you process your journey, that's what we want to help you and support you through. So some tips for treatment that I like to share. Definitely, if you are starting in this process, even if you're just in the testing process or the deciphering what's going on process, be kind to yourself. Relax, take care of yourself. This is already a super stressful time. We don't need to add to that and heap on guilt or any kind of blame for anything. This is not the time to start a new diet. We don't recommend deep cleaning your house or starting a new job. We understand these things can happen. So obviously, if it does, we roll with it. But we also recommend avoiding that if you have a choice. It's the perfect time to get pampered, eat some of your favorite foods, take some extra naps, and just really try to relax and let the physicians and the process work for you as well. We do recommend in treatment to limit your travel and your scheduled obligations, as treatment can have very specific dates that we need you to come in for certain appointments. And so we don't want to miss anything or mess anything up in your cycle. So we definitely just recommend overall limiting that travel and those, if you need to allow work to know just that you'll have appointments, not necessarily letting them know what you're doing, but just that you would have appointments or, doctor's visits you'd need to go to. And then also now with COVID-19, we want to reduce the risks. We know Chicago has some travel bans if you go to certain states. And so we just really recommend, again, just being as careful as possible, limiting those trips to more highly infectious COVID areas. But overall, we are really here to help you succeed. So I really appreciate you guys letting me share my little tips as what I've learned as being an FCI nurse and being here in my 3 years. And now is my pleasure to introduce our Andrology Lab Supervisor, Brenna. Brenna has been with FCI for 3 years and manages all of our FCI Andrology locations. She specialized in her graduate studies in male infertility and sperm development while she was getting her master's degree in biomedical sciences. Brenna, over to you.
Hi, everybody. It's a pleasure to be here. Thank you, Allie, for that wonderful introduction. I'm coming to you guys live from the lab today where what we do happens. And can I have my slides, please? Can you share the screen? Get those back. Thank you. So really, andrology is the study of male reproduction. So what our main focus is in the andrology lab is the semen samples. So we are responsible for receiving and processing all the semen samples that are going to come through FCI. We are currently operating out of 3 locations. We have Glenview and Hinsdale open Monday through Friday, and we perform IUIs, those intrauterine inseminations, at River North 7 days a week, because cycles do not care that it's the weekend. But we're really hoping to have all of our facilities up and running soon and increased access to Andrology Services. And what those Andrology Services are, the bread and butter, so to speak, of what we do in the lab is a semen analysis. It's the standard workup portion for all of our patients. And we look at 3 main factors. We utilize count, how many sperm are there, motility, what percentage of the sperm are moving, and then morphology, do they look normal? And what we have pictured here is an example of a normal sperm stain that we would look at underneath the microscope. We also prepare intrauterine inseminations. We wash and prepare the sperm for IUI. We do this with both fresh and frozen samples. And those frozen samples can come from a partner, a known donor, and also anonymous donors. We have a list of recommended cryobanks that we work with, and that's available to all of our patients. We can also cryopreserve or freeze your sperm for later use with IUI, which sometimes becomes necessary for patients with erratic schedules due to fertility preservation or any other reason that you would want to freeze sperm. We can do it for you. Now, so here it can be really challenging to know what is it that I look at in the lab all day. So I was able to take a video of an actual semen sample that we had washed and prepared for IUI in the lab. So this is an example of something that you'd see in the lab, and this is where we are able to analyze the count, the motility of the sample, and then we utilize another program to do the morphology because that's a little bit more intensive. So you guys are getting a good taste of what I look at all day. In order to get the samples to the lab, we do have a list of instructions. It's recommended that you abstain from ejaculation for 2 to 5 days. And when these samples are produced, they are produced into a sterile cup. And collection kits complete with sterile cups and all necessary off-site collection forms are available at any of our FCI locations. We ask that these samples are produced no more than 2 hours before your scheduled appointment time in order to ensure the best sample possible. And during that 2 hours or transport to the laboratory, that you keep it close to body temperature. And due to the pandemic right now, all samples must be produced off-site at home and presented to the laboratory at your scheduled appointment time. Now, after your workup is complete based on the results, when you meet back with the physician, they'll offer a recommendation of supplements and or referrals that can ensure that your sperm will be kept super. So I'm not the only lab here at Fertility Centers of Illinois, so I'm going to pass it over to Dr. Jürgen Lieberman and Rebecca or Becky Brohammer, who between them have almost 50 years of fertility experience, and it's not something that you're gonna find everywhere. So over to you, Jürgen.
Thank you very much, Brenna. Hi, everyone. We are excited to be a part of this meeting, and joining me for this short presentation, it's meant to be here, is my lab supervisor and manager, Rebecca Brohammer. And we have, as already mentioned, close to 50 years of experience. We are both with FCI since 2014. And I perform infertility treatment since '95. This is a short presentation, as I mentioned, and please write down your questions, hold on your questions. We are happy to answer them after this meeting. First slide, please. An IVF laboratory is undertaking different procedures. Next slide. And I made a very short summary here. It includes the preparation of the sperm. It will go on with the retrieval of the oocyte. When the fertilization, we mostly using injection of sperm in the oocyte. We culture the fertilized oocytes to a certain stage of embryos. We call it blastocysts. At this stage, we perform an embryo transfer, mostly on day 5. And remaining embryos or even oocytes, we are able to cryopreserve. If patients choose to have no transfer, rather than testing their embryos for normality, we will perform an embryo biopsy on day 5, day 6, or even day 7. Embryos will be frozen, the results will be sent out, and then we will inform the patients about the outcome of this genetic testing. Next slide, please. I want to lay out and make sure But I can assure you that we have staff here, 10 embryologists at different levels. We have about 4 levels. It starts with a junior or embryologist in training. It moves on to the junior embryologist, and finally a senior embryologist. And it takes about 4 to 5 years, but you do all the procedures I mentioned before independently. And every year we will evaluate the staff and we will check for their skill, proficiency, and their competency. Next slide, please. This is a short video we took in our laboratory which gives you a little bit idea what it means to inject a sperm in the oocyte. It's called an intracytoplasmic sperm injection. You see on the right side the ICSI needle that contains a single sperm. And when we punch it into oocyte, aspirate some cytoplasma, and move it back. And it will be released into cytoplasm and needle will be removed. From this time on, it takes about 16 to 18 hours where we can make an assessment of the oocyte if it was fertilized successfully or even not. Next slide, please. This is a short video that summarizes in about 90 seconds the embryo development. It starts with fertilization, the zygote. It moves on to a 4 and 8 cell embryo. On day 5, the single blastomers will come together, fuse to compacting embryos. And then on day 5, about 120 hours post-ICSI, you will see this stage of development we call blastocyst, containing 2 cell lines, trophectoderm. And when you look at the 7 o'clock position, this is in a cellmus. That's actually the future. Next slide. I mentioned before, we generate more embryos you might choose for transfer. So we are able to cryopreserve them at very low temperature. And we will use them later in a transfer, and mostly in natural cycle, and with frozen embryos stored indefinitely. If we make sure the temperature is at minus 96 degrees Celsius, they have the same ability to achieve pregnancies than fresh embryos. Next slide. We here at FCI, we perform since 2007 in very many patients single embryo transfers. We want to assure that you get pregnant. We also want to assure that you have a single healthy baby. We try to prevent a twin and multiples as much as possible. Next slide. Thank you very much, and I'm happy to answer, including Rebecca, your questions you might have later. Thank you.
So thank you so much, Jürgen, for all our attendees tonight. You may be wondering, why do we have an embryologist with us in a webinar entitled Virtual Fertility One-on-One? I mean, this should be probably the first step, and maybe IVF is the last step. It is important to mention that because those folks in the lab are technically our backbone. No matter how good a physician can be, if we do not have skilled and competent embryologists dealing with our embryos or with your embryos, we may not end up having good results. We are proud that we work with Dr. Lieberman and his team, and we're also proud to say that our IVF lab at River North is the only lab in the Midwest that freezes eggs for the largest egg bank in the USA, which is Donor Egg Bank USA. So and when you're starting your infertility journey, one of the main elements to look at is the lab that takes care of the embryos for this practice, because eventually if you end up going through IVF, you want to make sure you are in the best hands. I know that when I was looking for a job, I looked in very, very carefully at the lab, because at the end of the day, my results will technically reflect how good the lab is. I believe we went a lot in the medical aspect of things, and we went a lot in the technical aspect of things. Next, we come to a very important aspect in your treatment, and this is the holistic aspect. I'm glad to introduce next one of our psychologists here with us, Susan Rosado. Susan has been with us for a number of years, I believe. and I will pass the microphone to her. Susan?
Thank you, Dr. Hobeka. Can you all hear me? Yes.
I'm going to stop here so that you can see your face.
Yes. Okay. Thank you.
You want me to go to your slides?
Yes. So as you heard Dr. Hobeka say, you've heard so many different things about the medical aspects and some of the financial aspects of your care, but we also want you to know that you bring your whole self to your care here at FCI, and that includes what's going on in your current life, your emotions, your past experiences, and all of these will impact your treatment or choices you make for treatment. So we collaborate and work in tandem with your team to help complement your medical care. I am actually a social worker here at FCI, but my colleague is a psychologist, and our past colleagues were psychologists. So I kind of get bumped up in my status and often get called a doctor, but I am a clinical social worker. And my motivation to come to FCI and work here, as Dr. Hobeka was sharing his pride in our lab, in the team, is I was able to create my family here and have my children here. So it's definitely a practice many years ago, but a practice I truly believe in. So our mission is to support our patients by providing accessible care to help reduce the emotional stress that comes along with fertility treatment. And our objectives include working together with our clinical teams, our FCI staff, to support the most comprehensive and multidisciplinary approach to patient care. So we're very proud that we have all of our supportive partners through this care. Patients can refer themselves to see us, a physician or nurse can refer them, and we also see our patients with this fancy term collaborative reproduction referral, and that would mean any patients working with any type of third-party arrangement, donor sperm, donor egg, or using a surrogate carrier. Next slide. So here are our members of our team. Dr. Edwards, Tiffany Edwards is our full-time psychologist, and I am here a couple days a week and Saturdays. And we are multiple in-person locations in a regular time that isn't COVID. We are in the River North office, most commonly Hinsdale, every other week, in Buffalo Grove once a week. Right now, we are doing all of our consults by Zoom. We don't need to touch you or do an ultrasound, and so this kind of seems like a safe option. And many of our patients are very appreciative of that because they could be somewhere and Zoom with us, and so not always having to drive in for an appointment. We can see patients Monday through Saturdays. Next slide. So like I kind of indicated, and as many of you can imagine in considering treatment or being in treatment, that there may be many questions. There's a lot of uncertainty through this process. There may be decisions to be made. There's many questions that patients have concern about medications that they bring to the team and how to, they're concerned for side effects and how this is going to emotionally make them feel. There may be great disappointment, and as Allison indicated, we're here to help support you through those disappointments and those challenges. There may be frustration, there may be issues with communicating to those in your support system, colleagues, partners, family. So kind of talking about some communication strategies with this, it can be very overwhelming. And often there can be many other concurrent life stressors going on. Next slide. So we can offer, and what we do offer at FCI is we will provide a complimentary visit to you. And so we really encourage you to use that. Usually about half of our consults include some of those supportive visits, and there might be people kind of struggling through treatment, kind of figuring out what to do, decision making, and we're here to companion with you through that time. We also can offer another complimentary visit. That means these won't be billed to your insurance when patients are planning an IVF. We will bill for our services when somebody is going to see us ongoing for treatment. We can also help with referrals out in the community, or if somebody is seeing us for one of those third-party consultations and we're talking a little bit about working with donor sperm or donor egg. Next slide. So in the consultations, we may talk about some decision making, as Dr. Hobeika referred to. We want to hear your journey, what you've gone through, and how this story is about you, and what are your goals and hopes. We want to hear your motivation. We might talk about long-term and short-term implications, what you might plan on sharing with others and this child. A lot of times we're focusing on communication. That's a big issue, and we want you to stay close and continue that good communication with each other through this process if you are proceeding with a partner through this. We might want to talk about the timing and planning and hopes. We may talk about how to communicate, like we talked about, that best support for each other. How to talk to family and friends is a big one that comes up in a lot of kind of coping and strategizing, how to deal with those, the treatment stressors and outcomes or proposed outcomes. Next slide. And then if we meet with you for a third-party evaluation, that fancy term that if we might be, this might be a single person working with donor egg or donor sperm, or a couple working with one of these options or both, or choosing a gestational carrier. The American Society of Reproductive Medicine that we work under the umbrella recommends you meet with us, and we kind of have a psychoeducational session about this. And so we will do that, and we may talk about how you might choose who you might be working with as a donor candidate or a surrogate carrier. We might talk about this process. We definitely want to know what you understand about this process. If you are working together as a couple, we want to make sure you're together in this decision. And then we're going to talk about more future oriented with what might you share with this intended child, what might you share with your family and friends, and talk about some resources, websites, and support networks. We also are consulted when FCI patients are considering donating their extra embryos, additional embryos, when they are done with having their family, and talking about what's involved with that. Next slide. And finally, we have some support group options in the community. These groups are open to all patients. You don't have to be an FCI patient. Some of our patients become FCI patients because they've come to our groups, and our groups are very dynamic. In non-COVID times, they meet in person, and they love to connect with each other. And now we are meeting on a Zoom platform, and they're kind of doing that as well as the best that they can. People really appreciate that time to connect with others, especially in this more lonely COVID time when they kind of feel like they're going through this on their own. So we offer a group for women who are going through this journey or thinking about going through this journey on their own, for couples and support people, a regular infertility group. Those are both monthly, and then quarterly we offer our recurrent pregnancy loss group, Together We Begin Again. These are no charge. We just ask that you sign up and through the Eventbrite, and you be provided that Zoom link. Next slide. And now I'm honored to introduce Tammy Quinn. Tammy is one of our partners in caring for patients through Pulling Down the Moon. And as we said, we want you to be able to access all of those great community resources out there and the holistic partners that can help in this supportive journey. So thank you.
Thank you, Susan, and a big thank you to Fertility Centers of Illinois for inviting me to speak here today, and also for their belief that treating the whole patient and holistic therapies are very important in terms of treating the patient. So we'll start here with our first slide, please. Next. So I suspect that many of you on this call are just starting to try, or you've been doing this for a little while and maybe starting to get a little frustrated. And there may be some of you listening today that are already fully in treatment. One thing we know for sure is that you're probably here because it's a lot more difficult than you thought it would be, but it's important for you to know that you're not alone. And also that fertility can affect all aspects of your life, physically, mentally, financially, in relationships with people, and even spiritually. What we also know is that holistic lifestyle choices and whole health can be important in increasing your success rates. We're going to speak to what specific modalities might be important, but the other thing that we know for sure is that community and support really can be your secret sauce during this time. We know you're going to go online, you're going to research, you're going to Google, you're going to see Facebook groups, you're going to be inspired by Instagram accounts, which is absolutely fine. But we also want to make sure that we're giving you support and online resources that you can trust, that are not filled with inaccurate information, mixed messages, and opportunism. And just as Susan provided information, we also have lots of free, low-cost, and trusted resources that are available to you. Next slide, please. So what is Pulling Down the Moon? It's an awfully big name for a business that basically is a holistic fertility center and an online resource that was created by women for women specifically going through fertility, pregnancy, and postpartum. So my business partner and I founded the company 18 years ago because of our own journeys and our own stories. And we realized that it's really important not only to have support from your doctors, your nurses, your therapists, but also outside of the clinic in the community at large. We are the first holistic fertility center in the United States. So we are not somebody that also treats 20 other things on a menu, but are very specific to fertility, pregnancy, postpartum, and have certain services that are all designed for you to reach those goals during your journey. We have online and telehealth options available, as well as in person. Our center is open, and we have multiple locations, including River North and Highland Park. Most importantly, and why I'm here today, is because from the moment that we birthed Pulling Down the Moon, we knew that it would be important to work with your medical doctor, which is why Pulling Down the Moon feels it's very important that we communicate with your provider and that we have a seamless integration of both holistic services and medical services. And we often say in Chinese medicine that you can get to your goal a little faster by running on 2 legs versus hopping on 1. So something for you to think about as you continue on your journey. Next slide, please. We are based in science and rooted in ancient traditions. Our 4 core services include acupuncture. This means traditional Chinese medicine. And many of you might say, oh my gosh, needles, I hate that thought. They're actually sort of like the size of a fine hair on your bristle brush. This is a service that a lot of men, many of you are looking for support for your partners. So we do see a lot of men come for acupuncture as well. There is research suggesting that it can enhance conception rates when done in conjunction with IVF, but we have people who come to us with PCOS, male factor, unexplained infertility, people who are looking to work on egg quality, hormone regulation, increasing blood flow. So there's a lot of different things that acupuncture can be used for in conjunction with your medical treatment. Yoga for Fertility is now being offered online. It was featured in the New York Times, and we actually did a study with Fertility Centers of Illinois that showed both our online and in-person classes reduced anxiety by 20%. So we're really proud of our program, and it is unique to Pulling Down the Moon. Our fertility enhancing massage is different from what you might get at a Massage Envy or your local mom and pops, in that we focus specifically on increasing blood flow, releasing muscles and fascia, allowing for greater circulation of hormones, and building that blood-rich uterus for implantation. Nutrition and nutritional supplementations are a big one, and I know a lot of you have questions about that. I think that if you ask Dr. Hobeika, he might say that, you know, what you put into your body in terms of how you eat and what you eat is incredibly important. So we do know that overweight can contribute toward infertility, but we also are seeing that underweight can contribute as well. And being a fertile weight is incredibly important on this journey. We see a lot of women who come to us thinking they're eating a great diet, and in fact, they're not really nourishing up and allowing their bodies the extra nutrients that are necessary during this time. Nutritional supplements are something that we can also advise you on, and we suggest that it is best to actually see a licensed or registered dietitian before you make too many changes or start buying things off the internet, and to speak to your physician and make sure that you have all the correct information. So this is sort of a thumbnail of everything that is available to you, but most importantly, we want you to know that we are really providing services that have been proven to make a difference in your care, and something that we feel is very important for you to receive in terms of continued support for your journey. As part of this presentation, I know FCI will be sending information on how you can join us for a free Wellness Wednesday yoga class that will be online, and you will have a special code so you can join us and experience a little bit of rest and relaxation fertility yoga style at Pulling Down the Moon. So with that, I will now turn the mic back over to Dr. Hobeika for final comments and to allow the open forum for questions.
Thank you so much, Tammy, for being with us tonight, and thank you for ending this webinar in an amazing way. Most importantly, thank you for helping our patients throughout their journey. I believe all questions are currently being directed to Maren, and she will inform us on which question is next.
Hello, everyone. Now would be the best time to put in some questions if you have any for our expert panel. So go right ahead. You can wait a few minutes to kind of collect them. Okay, so the first one would be for Tammy. How can I sign up for acupuncture? I am currently starting IVF.
So the great thing about acupuncture is you can do it anytime, whether you're first starting in the middle of your cycle or actually going through IVF and in full process. So if you would like to go to our website, pullingdownthemoon.com, there is an online scheduler. You can sign up that way. You can also give us a call and talk to us specifically about what your needs are, and we can give you further support and assistance and help you get started with acupuncture.
So someone wants a little bit more information on how to join Wednesday yoga. So we will send out an email after where you'll be able to click on the link and see what classes Pulling Down the Moon has, and also how to get that free Wellness Wednesday yoga class. So can you walk us through the medication and process for egg freezing? That could go to either Andrology or Dr. Hobeika.
So in terms of egg freezing, the main treatment course consists of approximately 10 to 14 days of taking daily injectables. This may be preceded sometimes by a very short course of pre-treatment that could be either in the form of birth control or some hormonal treatment. But the whole cycle of active medication to grow the follicles to retrieve the eggs usually lasts between 10 to 14 days.
So we do have a question that was sent in when this person registered. So what is your % of success of live births from first, second, and third cycles of frozen embryo transfer?
So I believe the way this question is answered goes back to some information that we need to know. Usually in terms of frozen embryo transfer, the chances of success should be the same every single time a frozen embryo transfer is done, and they are related to the patient's age. For women under the age of 55, a fresh or a frozen embryo transfer will yield that if the embryo is unbiopsied, will yield a pregnancy rate of approximately 55 to 60%. And this is in women under the age of 35. And then based on the increased age brackets, this percentage starts to decrease between the ages of 35 and 37. Percentages are around 45%. Between 38, 39, 40, they go down to 35%, 40, 41 are 20%, and after 42 on a per blastocyst transfer for each embryo, it's usually 5% or less. I can pass the microphone also for Dr. Lieberman to just confirm these numbers if he wants to add any comments.
Yeah, there is nothing to add. Our success rate with frozen embryos, getting to the point, is comparable to the success with fresh embryos. So cryopreservation, the way how we cryopreserve embryos, we have a special technique called vitrification. It's a rapid freezing technology, allows us to be very successful in survival. It goes into high 90s, close to 89, 99%. And outcome with frozen embryos is comparable to fresh embryos. But as Dr. Hubeiger pointed out, it's depending on your age.
Okay. So this one says, I was told there is nothing else but CoQ10 to help with male morphology. What else is out there as my doctor jumped to IVF? So this could be for Brenna, our wonderful andrologist, in conjunction with embryologists.
I'll actually just jump in here to say that in this case, your physician may have jumped to IVF due to other mitigating factors as well as low morphology. Fish oil and CoQ10 are definitely among the different supplements that our physicians recommend to help increase morphology. And Dr. Hubeiger, could you comment any more on this, please?
Yes, I mean, as you mentioned, you are right. Morphology in itself is not a criteria that we lose sleep over. Mainly what we are interested in is the total number of sperm that are moving. And we would move to IVF if a male partner had a low number of moving sperm, or if the couple went through several inseminations and those did not work, and then they would move to IVF. But usually not only for a criteria of having abnormal shape. I'll pass also the mic to Dr. Lieberman to see if he has any input on that.
Supplement are out there and taken by patient. I think it's definitely mostly improving the motility and maybe the count. With morphology, I'm concerned that here any medication might do something to improve. This is genetically fixed, and in most cases, I don't think is any supplement out there who can improve morphology. But I also want to point out that as long as we have sperm and we have motile sperm, morphology is actually secondary. Morphology doesn't have or have less impact as most people maybe believe in terms of embryo development and outcome.
Okay. What is the success rate for IVF, IUI, and FET?
I think they've already spoken on the success rate for IVF, but I can jump in for IUI. So typically the success rate that we see for IUI is estimated between 10 and 15%. There are many factors that go along, both potential male and female factors, age, are you utilizing fresh or frozen sperm, and kind of what led you to IUI that can affect all of the different outcomes or success that we see with intrauterine inseminations.
Can you talk about the process regarding donor eggs and which bank is used? Dr. Hubeiger.
Oh, I was pointing to Dr. Lieberman, but in terms of the process of donor eggs, you have several options. One option is to use a fresh donor. So this is technically somebody who is undergoing IVF in parallel to the recipient having her lining being prepared, and who will undergo a full stimulation with retrieval of the eggs, creating of the embryos. And then once those eggs are retrieved, those eggs are technically the couple's eggs, and they are usually fertilized with the partner sperm. So this is using a fresh donor. Since you brought up in the question the notion of bank, there's also similar, like we have sperm banks, we have also egg banks, and couples can go to specified egg banks and purchase a lot of eggs and use them. The largest egg bank in the USA is called DEBU, or Donor Egg Bank USA. I will pass the microphone also to Dr. Lieberman to kind of fill you on the other egg banks that are available that our practice work with.
Yeah, you have actually two possibilities in terms of donor eggs. We can do a fresh retrieval with a donor of your choice, and when we would culture with embryos and you would receive a transfer, that means also you have to stay with us. You are fixed to one location wherever your donor is retrieved. The other option and most common now is, based on US Egg Bank that has about 100,000 donor on file. You pick a donor of your choice, you get a lot of information with donor in terms of education and so on. And then, wherever that donor egg are frozen, San Francisco or New York, they can be shipped to us. And then, you're much more flexible in your treatment, and success rates are very comparable with frozen eggs to fresh eggs.
Awesome. So can PGT affect embryos?
Jürgen?
Yeah.
PGT is a procedure where it requires to get to the information of the embryo to remove some cells. And we talk about a certain cell line, trough ectoderm cells. And at the stage we perform this embryo biopsy, the embryo has about 120 cells, and we remove about 5 to 10 cells. And that is a sufficient number to get an accurate procedure and result on the embryo. I would not 100% say there is no harm to the embryo, but at the moment it is a technique we need to perform to get the questions you seek on the genetic status of your embryo. I can also tell you that an intensive research is done on a non-invasive technique that tries to prevent the removal of cells. It will rely on the culture medium, and we can get the information out of the culture medium. We are at the moment part of a study, and it is not available at the moment, but I would assume in the next 6 months that technique will be available.
Is there another way of egg retrieval besides vaginally?
Yes, it's a second one, but it was one of the most common in 25 years ago. It is more complicated. It's a laparoscopic removal of oocytes using a very long needle and going through the belly to the ovary. Now, I would say 200% established is transvaginal egg retrieval. It's well taken by the patient. It requires a short sedation, and it's a very fast recovery, and the success in terms of recovery eggs is very high.
What is the process for the saline ultrasound, and does it hurt?
I will go actually to one of my slides to answer this question. This way we can have like some visual help. So don't get dizzy with me over here. So, excuse me. So in terms of the saline ultrasound, the goal is to answer 2 questions. One question is, are your tubes open? The second question is your uterus a safe place for the embryo to implant? And the test is done shortly after you stop bleeding. We put a very tiny catheter, so like a noodle-like catheter. We inject water on the inside, and then we inflate the uterus. And this is the picture that we want to see. We want to see the uterus like an inverted triangle. You can argue that it looks like a martini glass at this hour of the day. We do not want to see any polyps or any fibers, any scar tissue inside the uterus once we inflate with water. And we confirm that the tubes are open by making sure that air bubbles are going through both tubes. Usually this procedure is not painful. You may have some discomfort from the speculum, but usually this procedure is not painful. Because once we inject the water, there's no holdup of the water on the inside, and the water will leak out from the cervix if there's increased pressure, or it will go in the tubes. What may be painful, and what you may have read online that seems a little bit traumatizing and scary, is the hysterosalpingography or hysterosalpingogram, or the dye test. As you can see here, during the dye test, we do it in a radiology suite. We put a catheter that has a balloon that can inflate. Once this balloon is inflated, it can cause significant cramping. And once the dye is injected, there's no way for the extra dye to leak out if pressure builds up. And the uterus is usually not used to having a lot of pressure in it. So as dye is being injected and forced in the tube, this is where a lot of women can have cramping during that test. So back to your question, this is the picture of the water ultrasound. Usually the procedure is not painful.
I would then also, just from the nursing perspective and honestly personal perspective, because I've had two myself, it is definitely different based on each person. Everybody's a little different. We do recommend a little bit of like Tylenol or ibuprofen before to help with the cramping, just as a precaution. It doesn't hurt anything, to have it on board kind of ahead of time. It is the cramping kind of period type cramps that is the most uncomfortable. As Dr. Hobega mentioned, you kind of have a little bit of a waterfall rush of that fluid coming out. And so that initial when the fluid goes in, again, the uterus does not like it. It says, what are you doing to me? And and that's kind of that instant, ooh, okay, that's not comfortable. Then it goes out. And at that point, it's really, not any more uncomfortable than maybe a speculum. And again, everyone's tolerance is different. So for some people, when you go to your OBGYN and have a pap smear, that's incredibly painful. And so if a speculum is incredibly painful for you, or that process is, you can expect similar as far as the speculum goes, but then once the speculum is removed, that discomfort should be gone as well. But I would, it is very, very different for each person. But I would say really just more the cramping was uncomfortable and then went away pretty quickly.
So, when you get your fertility awareness checkup or any sort of diagnostic tests, how long do those test results last?
So a general rule of thumb is that the testing for ovarian reserve is valid for a year. In the fertility awareness test, that package includes a semen analysis for the male partner, an ultrasound for the female partner, where we look at the antral follicle count, or the total number of those dark circles that I showed you initially in my presentation, and two labs that are done on the third day at the same time of the ultrasound, that are a follicle stimulating hormone on day 3 and an estradiol level. In general rule of thumb is that any testing for ovarian reserve is valid for a year.
I am 45 and my husband is 59. What procedures can we do besides IVF?
So in terms of getting pregnant with your own eggs, the treatment besides IVF would be to induce ovulation, so ovulation induction. And for that, we may use similar medication that we use with IVF. And the goal is to grow as many follicles we can on the ovary and simultaneously do an intrauterine insemination whenever the follicles are of a mature size and we know that the eggs are sitting inside the tubes.
Oh, this is a good one. My doctor only works specific days. Why does my cycle need to be artificially adjusted to match their schedule?
Technically it doesn't. If your doctor works on specific days, you may want to discuss that with them on which days you want to do the cycle. But technically, artificially cycle, sometimes we give birth control or we artificially adjust cycles for ease of scheduling. If, for instance, you need a certain surgery or certain procedure and there is no availability on certain days of the week or on days where you may be ready at the time of your cycle for that procedure. So a good way of allowing those procedures to happen is by controlling your cycle. This will give us more leeway to schedule. But theoretically, a doctor can work on his schedule, but can also work on your schedule as well.
Is DHEA recommended for egg quality, and what other good nutritional supplements would you recommend? This could be Tammy.
I will start by saying it's always great to talk to your physician first and really get a plan of action. If you come to Pulling Down the Moon and you do meet with a registered dietitian and you do have clearance from your doctor, DHEA may or may not be recommended for you. It's very much an individual basis and based on some of your pre-existing conditions, your condition of your thyroid. Other sort of supplements that might be as appropriate are things like fish oils, myo-inositol, melatonin. But again, these are things that we do not recommend you take on your own, but rather under the advice of your physician or registered dietitian.
And whenever we recommend vitamins, it always goes back to the quality of evidence that's there. DHEA is definitely that is used, as Sammy said, in certain situations, and the HEA mainly is used to increase the number of eggs that respond to the medication, not quality per se. There are certain doses for medication to be taken. So DHEA is taken at a dose of 25 milligrams 3 times daily, but should not be taken for a duration more than 6 months. Another important vitamin for egg quality is an antioxidant called CoQ10. And this has the most studies in terms of egg quality, and it's recommended at a dose of 200 milligrams 3 times daily.
Okay. If eagerly looking to freeze embryos, how long would this process take from initial consultation to confirming the final number of successful genetically healthy embryos?
I would say that time frame somewhat depends a little bit on your cycle as far as when we can get the testing started. So if you came, and then of course the insurance piece, which always throws a fun curveball at us. So as soon as we had financial approval and we could do your workup, usually we expect that to take just your 1 cycle, or even really just 2 weeks. We do the day 3 testing, which tests your hormones. And then if we're just actually looking at embryos, saving embryos, we don't actually would need the remaining saline ultrasound, but that time frame still kind of affects us because of the fact that the AMH result and some of those other labs can take up to 5 to 7 business days. So we know that we're not going to just immediately get those same day results and then be back with your physician. So I would say if you're, expect a month usually is what we consider for that workup and evaluation cycle. And then once you get into the treatment itself, usually about 2 months, depending again on your results. If your doctor chooses to do a preparation for your cycle, like Dr. Hobeka mentioned, it can include birth control pills. It might include a medication called Lupron to suppress your hormones. Sometimes we start that when you ovulate. Sometimes we start that when your period comes. So it really just all varies. But I would say, if you had started a cycle tomorrow, you would definitely have, be getting into that IVF process by November, most likely getting into embryos with hopefully some results. Usually PGT results can take about 2 weeks, and you would have those before the end of 2020. So it's not, and that can vary. Like I said, I don't want to be like, oh yes, you will have these results, because things can happen and your specific case can be different. But I would say a healthy, conservative, 3 months is a time frame that would be very doable.
So this person is planning on doing a frozen embryo transfer, and they're already a client at Pulling Down the Moon. Should my husband come in leading up to giving his specimen?
So what we do know, I'm trusting that you're referring to acupuncture. We do know that there is some research that shows acupuncture can help the woman before and after embryo transfer. The research is less available for acupuncture on men. What I can say though is that it might help, and it certainly couldn't hurt. So we do advise a lot of women to bring their partners in just to help with increasing the relaxation response, preparing their bodies, and also giving them some dietary nutritional information that could be helpful during this time. We like to say it takes 2 to tango, and certainly we do recommend that your husband come with you for acupuncture if at all possible. If not, that's okay too. No need to beat yourself up. We do advise the woman come for sure, and if the men can, it's of course optional.
Are there any alternatives for the day of transfer in regards to anesthesia? It makes this person very sick and nauseous. Can twilight be done?
So in terms of providing anesthesia for the day of transfer, I believe we have done that before. So it's something that definitely can be done. And we do usually our transfer at our River North location downtown, and those usually follow the retrieval. So we have an anesthesiologist available if there is a need to do so.
Do you see many women that get pregnant with just taking metformin before they start IVF?
It's hard to pinpoint that question, because at that point, is it the metformin that helped them conceive, or it's the IVF process that helped them conceive? Definitely, metformin is prescribed in order to improve insulin resistance, and if a woman has like diabetes, controls her diabetes, so it will improve her health in general to conceive and to carry a pregnancy as well. So it's hard to say that that's the main element that that kind of turned the table and led to a positive pregnancy.
Okay. So this person says that clinics are good about communicating immediate concerns, but not much about the bigger picture, like things that will happen within the next month or year. So is this something that they should ask their nurse, or do they need to search the internet?
From the nursing perspective, I would say absolutely, please ask. We can't read your minds as much as we would love to be able to answer all your questions. We also know, because this process is overwhelming, I don't want to provide so much information that you just can't, it's information overload and none of it sticks and it kind of just all bounces off you because it's so much information. So if you have, we're going to give you that immediate next step, because we don't want to overwhelm you with what is going to be happening in 6 months from now. We have worked with your physician to get that exact picture, and we know what that's going to be. And so if that's something that you want to know, please absolutely ask us. If that's something we can answer for you, we would love to. It's just usually we are trying to give you that next practical, tangible step so that we don't overwhelm you with 10,000 details of what, if you get pregnant, your monitoring will look like. We know what that will look like, but we don't want to overwhelm you. But if that's something you want to know, we're happy to take those questions.
Ooh. Okay. So do we have an estimate when the CDC might lift the BMI requirements?
So in terms of the BMI requirements for the CDC, I'm assuming this has to do and that relates to COVID-19. So the CDC has put the requirements for women who have a BMI of 40 and above, that if they contract COVID-19, they are at significant and increased risk of having a bad disease and maybe ending up, God forbid, at the hospital due to complications of COVID-19. The disease, once the CDC will not change their recommendations, because they know that COVID-19 affects primarily patients that have a BMI above 40. What we have decided at Fertility Centers of Illinois is that in conjunction with that, we're going to offer treatment to patients who have a BMI of 45 and under.
Excellent. Okay, one more question. So this person has a history of recurrent miscarriage due to some chromosomal abnormalities. When there was testing done before the shelter in place, they had an AMH at 0.566 and they counted 13 follicles. What would you tell a patient considering FET if they could have another healthy baby, or if they should just give up?
I'm kind of lost here if the embryo was already formed or not. What I can assure her is that waiting a month or two before like the shutdown does not significantly changes the fertility of a woman. So definitely doing treatment before or now should not, the decision of proceeding with treatment should not be significantly affected by that. And again, the chances of frozen embryo transfer are mainly dependent by age.
You should never give up. There's always an option.
Yeah, exactly.
Okay, and then the last one, unless, okay, we have one more. Does Illinois insurance cover the fertility awareness checkup?
Is Judy still with us?
Oh.
Maybe you follow up on this question and then we circle back. I believe I am unaware because I believe the fertility awareness checkup was built in a way for those couples who do not have coverage for infertility or who just want a brief overview to undergo, and I believe it's like $90, including an ultrasound, the 2 blood works for women that we spoke about on the 3rd day, and a semen analysis for the male partner.
Okay. Is there a natural way to reduce FSH levels with diet?
Tammy, you want to take this one?
I think that it is certainly worth having a consultation with a registered dietitian. There are certain things that you can do to lower FSH. And one of the things that we really try to focus on too is just the overall health of the body, including inflammation and what might be causing inflammation in the body. So yeah, I think it would definitely be worthwhile. Again, a neg quality supplementation protocol could also be something that you should explore. So I would say there is definitely hope and options for someone with high FSH. And again, it's one of those things where acupuncture would also be a recommendation. And we would say get in to see an acupuncturist, get in to see a registered dietitian, and of course, work with your medical provider.
Excellent. Oh, okay, this is it. For someone who just turned 35 and was recently diagnosed with PCOS and they just had their IUD removed, how long should they wait trying to conceive before coming in to meet with a specialist?
So if it's PCOS with regular cycles, they can try for 6 months and then come back. The main element here in PCOS is the regularity of the cycles. As long as cycles are regular, we assume that there's an egg every month that's being ovulated, that's sitting in the tube waiting for sperm, so they can try. If cycles are irregular with PCOS, at that point they should come immediately because if ovulation is not regular, then we do not have an egg sitting in the tube waiting for the sperm to be fertilized. And that's the main disorder that we need to fix. We need to make sure that ovulation is happening in a healthy way. Before you go to the next one, Marin, allow me just, I believe we had a follow-up answer on the ability to, if a person is a candidate for IVF, to do a FET with PGT testing. So definitely, once you're going with IVF, the more eggs you have initially, the higher the chances it is for us to end up having an embryo that's chromosomally abnormal. Because regardless of age, regardless of everything else, there is a drop-off in number with every step in IVF you go through. Not all the follicles that we see on ultrasound will respond to the medication and grow. Not all the follicles that get to a good size will yield an egg. Not all the eggs that we get will be mature. Not all the mature ones will fertilize normally, and not all the ones that fertilize normally are gonna grow in our dish, and not all the embryos that will grow can be biopsied, and not the embryos that can be biopsied can be chromosomally normal. I do not mean to scare you by giving you all these ifs and milestones, but it is a reality that sometimes we do not think of it. So you are always a candidate. The goal here is to have you do a protocol that will yield the maximum amount of eggs that can grow on your ovaries and the maximum number of follicles or eggs that we can extract, so that we increase your chance of, at the end of the day, ending up with an embryo that is genetically normal. And if you have a lower number compared to somebody who have a high number, you may need more tries to achieve that number, as opposed to somebody who can produce 30 eggs all at once. At that point, they are more likely to achieve that number with just one IVF cycle.
Define what a regular cycle is.
So that's a very, very good question. So it's somehow presumed that a regular cycle is 28 days. It's only 15 to 20% of women that have a 28-day cycle. we mean by a regular cycle is a cycle that recurs every month at the same time. That means it could be anywhere from, I want to say, 24, 25 days to approximately 35 days. So if it happens every month at 30 days, that's regular. If every month you have your cycle at 32 days, and that's from start of the period until start of the next one. Some people say that down to 21 to 35 is still within normal, but as long as it's recurring at from start to start of the period on a fixed interval, that's what we consider regular. More than those two intervals, then we would recommend that you come for testing. And heavy or light, I believe I'm reading the thread. Heavy and light is also somehow something that's subjective. There's a certain criteria that the menses should be 80 cc. I have never met a woman that can quantify the amount of bleeding by saying how many cc's or how many milliliters of bleeding she had. So I would say if you have the subjective feeling that this is too much, one can always benefit from doing an evaluation or doing a water ultrasound. Maybe there's something else that's causing heavy bleeding or heavy menses.
Okay. Any other questions? We got 2 minutes left.
I wanted to just say too, Heidi, we definitely understand that it can be super hard to have that frequent loss. It is not easy at all. So definitely getting medical intervention is really recommended. There might be other underlying issues causing the frequent losses. But just also, thanks for sharing that with us too. It's not easy to talk about these things. Our society should. It happens to way more of us than I think people realize until it affects you. But we do really appreciate your boldness in just bringing that up and sharing that with us too.
Okay, so we got lots of questions now. Dr. Hobeika, do you want to pick one out of the 5 that came in?
Why don't you do that for me? It's a tough choice.
Okay. Due to my age and responsibilities, I would like to only go through a pregnancy once and ideally have twins. Is that something that FCI doctors would be willing to support if requested?
Jürgen, you spoke about the one healthy baby at a time.
Yeah, that is correct. That's what we recommend. It's based on enough research done by CDC and by SART that the twin pregnancies are risk pregnancies. So there's enough numbers out there where they are proven that they have lower birth weight, shorter pregnancy duration, and so on. But on the end of the day, when we have a transfer and we have embryos available, we will talk to the patient and we can go through this procedure. And it's a patient's decision. If she want to have two, we will transfer two, but we will share our knowledge about multiples and the risk of multiples, but it's patient's decision. If she want to have two, we will transfer two.
Yeah, I just also want to add that whenever we're doing infertility treatment, we aim for a goal. You can always get less than the goal that you aimed for, but you can always get more than the goal that you aimed for. I believe Jürgen and I and one of the nurses know that we currently have a patient that has triplets who just wanted 2 embryos. And I personally have a patient who has twins who just wanted 1 embryo, and this embryo decides to split. So embryos can split after you put them back inside the uterus. And those are usually the twins that are identical. So 2 boys or 2 girls, exactly the same. And if you have another embryo that implanted next to them, you're ending up with 3. And one needs to put things in perspective. What is the risk that am I taking this for? We know that triplet gestations are a much higher risk of prematurity. Sometimes prematurity can be an okay consequence, and we may end up having 3 healthy children, but sometimes the repercussions are not that okay, and sometimes we may not have a viable birth if miscarriage or preterm labor occurs very early. But again, it's a shared decision that we make with the patient. If you're okay with it, you're aware of the risk, we're fine with it.
Okay. That will be it for our Virtual Fertility 101, round 2 with Dr. Hobeika and our wonderful panel. Thank you so much to everyone for coming. And if you'd like any more information, please visit us at fcionline.com. Bye-bye.
Thank you so much, everyone.